I am Dr. Nama Ratnayaka from Faculty of Medicine, Sabaragama University of Sri Lanka. Today in my snake YouTube channel, I would like to talk about some facts about the snakes and snake bites in Sri Lanka. That is, this is an overview. Uh, you can see now in the slides up to the current data. There are 109 snake species in Sri Lanka, including 15 of sea snakes, 93 of land snakes, and water snakes. In Sinhala, we call Redinaya or Redigoya, that lives in brackish water. These snakes belongs to 12 families, 37 genera, and interestingly, we have one endemic genus we call genus Rhinophis in singular, Tudulla or Valgabbia, and it is very surprising that there we have the 58 of endemic species, and this snake fauna makes the highest biodiversity in our country. The snakes can be classified basically or the traditionally into two groups. One group is venomous snakes, other group is non-venomous snakes. Again, the venomous snakes can be classified into highest medical important snakes and lesser medical important snakes. This classification is because of the snakes that cause severe effects after biting, which means severe effect means severe local effects, severe local necrosis, uh, and local swelling, or the severe systemic effects, acute kidney injury, which progress to chronic kidney disease, then venom-induced consumption coagulopathy, thrombotic microangiopathy, and cardiotoxic effects, microangiopathic hemolytic anemia, like that. They cause these severe systemic effects. In this category, hound-nosed viper, Russell's viper, cobra, common crate or Indian crate, soy-scaled viper, green pit viper, Ceylon crate, sea snakes are classified. And lesser medical important snakes, which means now lesser medical important snakes we classify because in these snakes, when they bite, they cause the only local effects, mild local effects like local pain, swelling, redness, like that. It includes cat snakes, coral snakes, flying snakes, vine snakes, Sri Lanka blossom crates, dog-faced water snakes, Gerard water snakes, and uh, in these slides you can see the highest medical importance snakes in Sri Lanka. Russell's viper, Titpolanga, common crate or Indian crate, tail caravala, and sea snakes, hound-nosed pit viper, Kunakatua or Polonterissa, cobra, soy-scaled viper, that is the valley polanga, green pit viper, pala polanga, and Ceylon crate, Mudu caravala. Uh, when we consider the hound-nosed pit vipers, the genus is Hypnali. This genus includes 3 species. The most frequently encountered snakes, like 80% is the Hypnali or Kunakatua or Polontelissa. Then Hypnali Sara, or local or lowland hound-nosed pit viper or Patharata Mukalanterissa, or least frequently encountered species is Hypnani nipa, or Highland Hamnos pitviper, or Kanukara mukalantirisa. You can see now to our naked eye, these species are looked alike. But carefully, when we observe, we can uh, identify species size in these snakes. This list shows the 15 species of sea snakes species living in our coastal areas. Out of these 15, only uh, these are the important snake up to now because uh, there are reports or case reports or one studies describing their bites, their human bites. Out of these three, the Enhydrina cystosa or Valacadia is the deadliest one. From its bites, one death has been reported. These two are they causing uh, only some systemic effects, but there are no deaths reported. These are the lesser medical important snakes in Sri Lanka. Cat snakes, Mapila, slender coral snake, depat kalua, blood-bellied coral snake, Badaratu depat kalua, Sri Lankan flying snake, Dangradanda, ornate flying snake, Malsara, Sri Lankan blossom crate, Nihalua. Green wine snake, Ehatulla, brown wine snake, Enakandaya, dog-faced water snake, Kurudia kalua, Gerard's water snake, Kadulana, Piabaria. There is a concept called big four snakes in our neighboring country, India. These snakes are Russell's viper, soy-scaled viper, cobra, and common crate. They are the main four snakes that cause severe burden to India. The snake families. Mainly there are two snake families in which the highest medical important snakes are belong to. First one is this family Viperidae. It includes all vipers. These vipers classified into true vipers and pit vipers. True vipers are the Russell's viper and soy-scaled viper. Pit vipers are the hum-nosed pit viper, green pit viper. This division is due to the presence of lower pit in these pit vipers. Then the family Elapidae, it includes crates, Ceylon crate and common crate, cobra, najanja, and sea snakes. Sea snakes also is further classified in subfamily Hydrophidae. Earlier I said that these vipers can be classified into true vipers and pit vipers. In pit vipers, you can see this is the loreal pit or pit organ, which situates in between the nostril and the eye of the snake. It can be found in hum-nosed pit viper and the green pit viper. The pit organ or loreal pit helps them to get sensation. There are important non-venomous snakes. These are called these wolf snakes and bridle snakes because their morphology is somewhat very similar to crates, which are highly medically important snakes. This is the common wolf snake, Aluradhanakya, Shorsh wolf snake, Kabaradhanakya, Sri Lankan wolf snake, Dharadhanakya, common bridle snake, Yataradhanakya. This is Chitrasekara's bridle snake. And because of the now there are reports because of these wool snakes and bridle snakes. Uh, Bridle snakes they have been misidentified and misidentified as bitten by crates and administration of antivenom. That is therefore these even though they are non-venomous, they are very important because frequently they have been misidentified as crates. But easily they can be the crates and these non-venomous wool snakes can be identified from this row of this vertebral scales. This is the vertebral scales. You can see these are the crates, the common crates and Indian crates. They have large this hexagonal vertebral scales. You can see very clearly. You can see it, and this is wolf snake. Actually, this is a Sri Lankan wolf snake. They have only this. These dorsal scales are same in size. You can see now there are no vertebral such large vertebral scales in these snakes. Therefore, this feature can be used to differentiate these snakes. This is a clear picture. You can see these vertebral scales, the row of these vertebral scales in crates, subcrates, and this is the wool snakes. There are no only these. There are no such large scales. Only those scales are same in size. And another feature we can use to identify or differentiate crates from wool snakes or bridle snakes. That feature is the divided subcaudals. These are published subcaudals can be seen in the belly. Now the ventral aspect of this aspect of the tail of these snakes. In crates, these subcaudals, you can see these subcaudals are not divided. We call uniserial. But in wool snakes or bridle snakes, these subcaudals are biserial. That is, they are divided. This feature, that is the division of subcaudals, presence of the divided or uniserial subcaudals can be used to differentiate only for these crates and wool snakes. Because we can when we look when we see the Russell swipe or the Hamno swiper, they are highly medically important snakes, but their tail or the subcaudals, the subcaudals, they are also divided by series. Therefore, it is not the divided subcaudal is not a feature of non-venomous snakes. Presence of divided subcaudal is not a feature of this non-venomous snakes. Both venomous and non-venomous both have, you can see these biserial subcaudals. The cat snakes. There are 5 species of cat snakes. This is Sri Lankan cat snake, Nidimapila. This is Burmese cat snake, Padrumapila. This is common cat snake, Ranmapila or Garadimapila. And this is Ranavana's cat snake. This is recently confirmed presence of species in Sri Lanka, Ranavana's Mapila. And this is Boiga Forsternis cat snakes. According to the morphological color variation, there are 3 Sinhala names called Lemapila. This is Kabaramapila. This is Nalamapila. This map shows the distribution of cat snakes in Sri Lanka according to the climatic zones. You can see the most frequently encountered species is the Boiga silonensis, that is the Nidima. These are the distribution of other medically important snakes in Sri Lanka. You can see now this is the common crate or Indian crate. Mainly, it can be seen in this region, that is the dry zone. Sometimes it can be seen in this intermediate zone also. And Ceylon crate mainly it is found in this wet zone, sometimes in intermediate zone also. Then this is Russell's viper, cobra, green pit vipers. They can be seen all over the country. But when we consider the source-gate viper or valley polaga, it mainly confined to these coastal areas of the country. This arid zone, this coastal area, mainly this Puttalam and Mana and Rincomalee, like that, this coastal region. Considering Hamno's pit vipers, I said that the most frequently encountered species is Hypnale. Hypnale, it can be seen in all over the country. It is distributed in all districts in Sri Lanka. Then considering the Hypnale Sara and Hypnale Nipa, main they are distributed in the red zone, and sometimes Hypnale Sara can be seen in intermediate zone also. But considering Hypnale Nipa, they mainly confined to central hills of the country. Mainly this Ratnapura and Nuvareli. Ratnapura, considering Ratnapura, it is a Sri Pada mountain and Horton plain in Nuvareli. And when considering these land snakes, there are 9 highly medical important land snakes. I said that we classified highly medically important and lesser medical important because of their effects after bite. They cause some effects, including both local and severe local effects and systemic effects. These 9 snakes are cobra, common crate, Ceylon crate, Russell's viper, sword-scaled viper, 3 species of nose pit vipers, and green pit viper. In this way, now you may understand that majority of snakes are non-venomous or harmless. Right. Now we can talk about some data on snake bites. You know, it is the snake bites are major public health issue across the tropics and subtropics. Most of the burn is recorded from South Asia, South Asia, Southeast Asia, and Sub-Saharan Africa. Considering the global burden, there are 4.5 to 5.5 million of snake bites per year, and entominomies are 0.5 to 1.8 million per year. You know now, this when we say snake bites and entoming are 2 different entities, and in the snake bite, it also included the dry bites. We call dry bites, even though snake bites occurs in dry bites, the venom is not injected, therefore no effects. There are no effects, and we call it dry bites. And deaths are 94,000 per year. In Sri Lanka, all snake bites are around 8,500 per year, all elunoming around 30,500 per year, and all deaths are 464 per year. And when we consider the snake bites, there is geographical variation in the incidence, hospital admission, and the biting species. And when you consider there are difference of hospital admissions in dry zones and wet zone and this intermediate zone like that. The provincial distribution of snake bites. You can see in this chart the provincial distribution of snake bite. Western, Central, Sabragamua, Northwestern, Southern, Uva, Northern, Eastern, and North Central provinces. The highest rate has been recorded from North Central province. You can see this. Then the lowest one has been recorded from the Central province. The variation in biting species. When you consider the hum-nosed pit viper, it is about 22 to 70% of all snake bites. Roughly, it is 1/3 of all snake bites. Out of this, hypnale causes 16 to 82% bite. Hypnale sara causes 14 to 47% of bites. Hypnale nipa causes 4% of bites. In Russell's viper, in dry zone, it is 30 to 40% of bites. Soy skate viper causes 45% of bites in Jaffna Peninsula, and cobra causes 3% of bites in Anuradhapura. Common crate also in Anuradhapura around 9% of bites. Considering the green pit viper, it is around 3 or 2.8% of bite in Ratnapura. Considering Ceylon crates, only one case, only case reports and the case series are available regarding this Ceylon crate bites. These are the dates up to now, the recorded dates from various snake species. Deaths occur from Russell's viper, cobra, common crate, hypnale, Ceylon crate, hypnale sara. Out of 15 species of sea snakes, only Enhydrina cystosa, that's Valaccadia, caused one death. No death reported from soy scaled viper, green pit viper, and hypnale nipa, but their venom has a potential to cause deaths. Consider death rates. Russell's viper causes 1.6 to 4% deaths in Anuradhapura. Hum-nosed picked vipers 1.3% in Ratnapura. Common crates causes 7.6% of deaths in Anuradhapura. Cobra, the case fatality rate is 8%. There are 2 died reported out of 33 cases in this Anuradhapura and Peradeniya study. In considering Ceylon crates, 1 death has been described in the case report, and there are no further data regarding these common crate bites. Deaths. Considering sea snakes, 2 deaths occurred describing these 2 case reports. One is the species not identified, it's unknown sea snake bite. Another one is Hydrophis cystosus, we call it Valaccadia bite. Considering the sea snake bites, death has been reported at the 24th day of snake bite in Jaffna. But unfortunately, the snakes is unknown sea snake bite. It has not been identified. There's other bite by Hydrophis spiralis, which caused neuropharetic features. Then other two bites, one by Hydrophis platurus and Enhydra cystosa, but those were dry bites, no any known feature. Then other study, there were three patients presented with sea snakes bites. The biting species is Enhydrina cystosa valacadia. They had this myotoxicity. Out of three patients, two recovered and one died. Yes, I think you can understand now the severity of snakes bites in Sri Lanka. And thank you very much.